I want to welcome everyone to this exclusive Psychedelics Spotlight interview, where today we have the privilege of being joined by Dr. Albert Garcia-Romeu of the Johns Hopkins Center for Psychedelic and Consciousness Research. Doctor, thank you so much for taking time to join me here today.
Yeah, no problem. Thanks for having me.
Great. So I think we can probably agree that over the last couple of years, there has been a significant amount of progress with the study and research surrounding psychedelic medicine, which has been incredibly important in helping us gain a more helpful and beneficial understanding of the efficacy involved with psychedelics when integrated into psychotherapeutic programs. And in this process, Johns Hopkins really has been at the forefront of many of these clinical trials and studies, which is why I'm so grateful for this opportunity to speak with you. And so I guess to just kick things off here, if you want to talk to me a little bit about some of the psychedelic related work and research programs that you're currently involved with, I think that'd be a good way to start things off.
Yeah, absolutely. So we last year established the Johns Hopkins Center for Psychedelic and Consciousness Research. Timing was kind of funny on that because of the current coronavirus situation. So we kicked off with a bang at the end of last year. Actually, it was about a year ago now. And then as we started to get up and running with some of the new studies that were part and parcel of the center, we had to kind of put the brakes on, if you will, because of the COVID-19 related concerns and obviously quarantine and all that kind of stuff that was going on since March roughly. So it has put us a little bit more behind schedule than we would have liked. However, we do have a number of clinical trials that either have been ongoing since before the establishment of the center, as well as a number of newer trials that started along with the center, and then some other ones that will be starting in the next 1 to 2 years as part of the sort of continued mission of the center. So that's a lot of different projects. I haven't been directly involved with all of them, but I'll try to give you kind of a general outline of what's going on here. The main work that I've been involved with and that's been going on for some time here with Dr. Matt Johnson at the helm is psilocybin for smoking cessation. So specifically to help people who are tobacco or nicotine dependent get off of the cigarettes, which can be quite difficult, a huge public health concern. We published a small pilot study in 2014 where we had some really positive and promising results, but it was an open label trial, so there's no control condition. There was just a very small sample of 15 smokers. So that's the kind of thing that, it opens the door to additional research. And so that's one of the main things that I'm working on now is a follow-up study where we're looking at psilocybin with cognitive behavioral therapy in a randomized control trial. And for that study, we're having about 80 smokers go through the program. Half are getting psilocybin, half are getting the nicotine patches, and we're kind of tracking their treatment outcomes through 6 and 12 months post-treatment. Doing a little bit of neuroimaging or fMRI work as well to try to understand the brain mechanisms involved there. So that's been a big one that I've been working on with Matt and Roland and our colleagues here since I got here in 2012. That's kind of been an iterative process where you build on the past work and kind of build these larger projects. Similarly, we're currently starting a new study of psilocybin in people with depressed mood and early stage Alzheimer's disease. So it's pretty common that when people get a diagnosis like Alzheimer's, early on in the process, they're just beginning to have memory problems. It's an upsetting situation, as you would imagine. And as a result, there can be some existential distress, anxiety, depressed mood. In terms of what we know clinically, the currently available medications for managing things like depression in that situation don't always work as well as we would like. And there's pretty good evidence that's kind of accumulating now that psilocybin has pretty robust, rapid-acting antidepressant effects. And so our idea was really to zero in on the specific population of people who are just getting this diagnosis of Alzheimer's or potentially mild cognitive impairment, which often kind of come hand in hand. And then seeing if it impacts their mood and their quality of life and can kind of help them get over that bump of dealing with depression. Of course, one of the big complaints is memory problems when you have those types of conditions. And, we are going to explore whether the psilocybin treatment has any impact on memory as well. And of course, our fingers crossed on that, but can't say for sure. And so those are two of the studies that I'm primarily focusing on over the last, year or two or last several years with the smoking work. And then at the center, we've also got a number of other new studies that are either just starting up or ongoing. Studies of psilocybin in people with anorexia nervosa. A new study that's getting started by my colleague, Dr. Fred Barrett, where we'll be examining the use of psilocybin in treating people who have both major depression and alcohol use disorder. That's an important study because a lot of these trials, and it's commonly criticized that when you do these types of clinical trials, to test a medication for efficacy, you can sort of pick these magical creatures who have just one problem or one issue presenting and no other ones, which when you go out in the real world situations, people are often dealing with a number of what we call comorbidities, but really just a number of adjacent kind of interrelated issues. So a person might not just have an alcohol use problem, but they could have an alcohol use problem, a mood issue, an anxiety issue, or a post-traumatic stress issue. And when you have all of these things kind of together, it can make it more difficult to say cleanly that, yes, the medication is working. So oftentimes you kind of funnel it down to this very specific condition, which is good scientifically because you control things very closely, but in terms of the real world use in clinical settings, this is much more similar to what you would see where, a person might show up with both an alcohol problem and a mood problem. So that's a new study that will be getting off the ground soon.
And yeah, that's actually an area, that's actually a topic that I'm hoping to kind of dive a little bit more into is the use of psilocybin-assisted therapy for alcohol dependency. And I think you brought up a really good point in that in many instances, we see individuals that have interconnected sort of conditions, whether it's depression and which then leads to the alcohol dependency. I mean, to be quite personal and honest here with you, my father, who passed away 2 years ago, actually suffered from depression, and that did lead to alcohol dependency, which eventually led to the decline in his health and passing away at a relatively young age of 59. So this has been an area that I've really been very interested in. And so can you kind of help break down a little bit what specifics make psilocybin-assisted therapy so effective here, especially when you look at it in comparison to other treatments and other maybe pharma-based drugs that have been used? What helps psilocybin sort of stand out and separate itself from other therapies and treatments?
Well, there's something about the psychological salience of the actual high-dose drug experience. Now, there's a lot of interest in looking at these psychedelics. Psilocybin obviously is the one that we're mainly focusing on right now at the center, though, we've also done work with drugs like dextromethorphan and salvia divinorum and studying other compounds like DMT. So there's a lot of different types of psychedelics and hallucinogens that, are of interest, but honing in on these specific, what we call classic psychedelics, like psilocybin and LSD, they seem to, when taken at the appropriate dosages, really help facilitate these powerful experiences. They're not always pleasant. So, sometimes people talk about quote unquote bad trips, but really, one of the big markers of these experiences is that they come with a strong sense of meaning and authority. And oftentimes they can also have some features such as feelings of unity with oneself or with one's surroundings, feelings of transcending time and space. So we call these markers of what they call the mystical experience or mystical type experience, which is something that seems to correlate with good treatment outcomes pretty much across the board in all the studies that we've done with psilocybin. And so if you take, for instance, people who are struggling with cancer and anxiety, or cigarette smokers who are trying to quit,
Right.
or even healthy volunteers who don't have a clinical condition. And you'll find that across all these different people, the more of these specific qualities that they report from their experience, such as the feelings of unity, transcending time and space, a sense of sacredness, the greater changes they see down the line in terms of improvements in their depressed mood or anxiety, improvements in their cigarette smoking and craving reductions, or in the case of healthy volunteers, increases in their openness and personality, which is a change in personality that we see lasting months after the administration of these psychedelics in the laboratory. So, that's one of the things that seems to stick out in terms of psychological mechanisms of action. There's something that people sometimes call an overview effect, which it's almost like going into outer space, seeing the whole world from this really kind of big picture place, and then coming back down and realizing, oh, the problems I was focusing on down here on the ground are actually manageable. And there's all this other stuff that kind of really helps me put things in perspective. And when they come back from these types of experiences, people can often help get realigned with what they think is really important and change their behavior as a result. And those are just some of the psychological mechanisms in terms of how our minds work. But there's a lot more work being done now, and since about 2012, we've really seen a lot of great brain-based science to help us understand the changes in the different parts of the brain that are communicating, the way that those parts of the brain communicate, whether they're over or underactive, and that is also, of course, a big part of the biological mechanisms that we're still kind of piecing together and learning more about. But we're seeing changes in brain function even a week and a month after administration of psilocybin. So that's really telling that, parts of the brain like the colostrum, the amygdala, what they call the default mode network, which is a whole, different portions of the brain, but the way that they are interconnected, the way that they're communicating, and the way that they're functioning, both under the influence and after the experience, is being altered by the drug. Right. And so that's kind of what we're unpacking now in terms of some of those more brain-based effects. There's other stuff that we're just learning. I mean, literally, I think yesterday or the day before, there's a study showing low doses of LSD are increasing levels of brain-derived neurotrophic factor, which is a chemical that helps grow new outgrowths in the brain as well as new cells. And so, those types of, neurochemical changes, are all kind of different parts of the story here that we're kind of getting more and more deeply acquainted with as we're able to conduct more research. Because, I think the big holdup here was that from about 1970 till about the mid 90s, I'd say, you really didn't see a lot of work being done with the psychedelics in terms of understanding their biological mechanisms or their clinical potential, just because of taboo and restrictions. So,
Right. And so, I mean, with that in mind, and with, the fact that you have really been involved in this space now, since 2012, I'm sure you've witnessed firsthand the progress that it's made just in that relatively short amount of time. Talk to me a little bit. I mean, you mentioned that the taboo and the stigma that's sort of been associated with psychedelics for, so many years. I think we're starting to see that slowly dissipate, and we're starting to see people sort of embrace the therapeutic benefits of psychedelics a little bit more, and certainly approaching it with more of an open mind. Is that something that you're sort of experiencing yourself, especially being so connected into the medical community? Are you sort of seeing people starting to really recognize that, hey, this is something more than just a recreational drug, that there really are potential therapeutic benefits here?
There's a lot of kind of angles to that question. And I think one of them I like to start with is just, generationally. So I was born in 1981. So the people who were born around that time and afterwards have a very different conception of these types of drugs than people who were around during the 1960s, say, and 70s. And, the heyday of the quote unquote psychedelic 60s and the hippie counterculture and all the stuff that was going on back then, I think really was the beginning of the backlash against these types of drugs. And so, when the Nixon administration really kind of launched the quote unquote war on drugs and started, putting into place restrictions like the Controlled Substances Act, which, heavily restricted possession and use of the psychedelics and cannabis, which was around 1970, you saw a sort of turning of the tide in terms of public opinion around these drugs. And there's even, scare stories about how it would damage your chromosomes and your DNA and stuff like that, which was later disproven. But, that's the type of thing that, carries baggage for some time, for decades and generations. And so I think the people who were around back then, have a recollection of that period of time, and also obviously quite turbulent, not unlike today, in terms of the, all the other stuff that was going on, whether we're talking about the civil rights movement, the anti-Vietnam War protests, and so forth. And so, you kind of lump LSD or psychedelics in there with all that, and it can, for some, sort of bring up some negative associations. But if you kind of take a step back and look at these substances, both historically in a larger picture. So they've been used for millennia by indigenous people. So we know that there's a history there. And that also shows some degree of safety in terms of the way that they've been used. But, in addition to that, we also have the sort of scientific lens, which really shows us that particularly drugs like psilocybin, LSD, ayahuasca, do not have a high physiological risk. And so really the risk factor there is much more psychological, and particularly, when they're used in ways or in places or by people who maybe shouldn't be using them, then you do have a risk, and it's not as predictable as, taking a couple of aspirin. And so that makes it a little bit less attractive to some people who are very concerned about those risks, which are real risks, the psychological risks. But at the same time, the work that was happening both in the scientific arena in the 1950s and 60s looking at LSD, and more recently, since 2000, looking at psilocybin and MDMA as well, really points to there being a very good way of using these substances safely, as long as you screen people beforehand, you thoroughly make sure that they're physically and psychologically healthy enough to manage that type of treatment, and you do it in a place that's safe with people who are trained to do it properly. And when you do that, you look at the clinical trials for MAPS, you look at the work that's been done at Hopkins, at Imperial College London, University of Zurich, and you see a very low rate of serious problem events.
Right.
And that indicates that these substances can be used safely in a therapeutic manner. it just is a matter of making sure that the container is set up in the right way. And so that's, something that took some refinement, but I think we have a fairly good handle on now, and I think you'll see further refinement, in the next decade, I hope.
Yeah, absolutely. And I mean, the work that you with Johns Hopkins are involved in, you mentioned MAPS. I think this is important, in helping to shift that conversation and helping to sort of shed light on the more positive side of things here with psychedelics. I mean, with myself being born in 1982, I was sort of, from a very young age, it was drilled into my head, drugs are bad. The commercials, this is your brain on drugs. And then the DARE program in school. And all drugs got lumped into it. So, whether it was marijuana, whether it was mushrooms, LSD, everything sort of just got lumped into one class as drugs. And so what I've noticed, is that, things are starting to change, but it does require education. It does require being exposed to, information to help sort of train or change that train of thought that we've been so used to and accustomed to looking at drugs, from a perspective of they're bad, to now, okay, maybe they're not all bad. Maybe there is some therapeutic benefits to some of them. And again, I really point to the work that you guys are involved in helping to sort of, reshape, the perception associated with psychedelics. So I really, really do appreciate, you taking the time to speak with me. And again, I'm so grateful for the work that you're doing there. And I hope that we can stay connected. I'm not sure if there's anything else that you wanted to add here, but again, I just really appreciate you taking the time to speak with me.
Absolutely. And, I think this has been a labor of love for a lot of people. I'm happy to be able to have gotten involved with this because it's something that I feel strongly about and I'm passionate about. But, a lot of people have been working on this, like Rick Doblin and Roland Griffiths and Bill Richards for decades, and Matt Johnson. And, it's something that, we're all trying to work together towards. And I think that that's one piece I left out of my last answer, which is, there, I think, is a little bit more openness now to the therapeutic potential of these substances because there are also these huge mental health and public health needs. And so we're seeing, depression, suicidality, addiction. I mean, looking at the opioid crisis that's been going on for the last several years, you really kind of see that in sharp focus. And while you are continuing to see all that stuff pile up, you're not seeing a similar kind of evolution of treatments and specifically of efficacy of treatments. And so, for instance, looking specifically at treating depression, the last major kind of breakthrough there was moving from some of the more primitive antidepressants that we had to the newer generation of selective serotonin reuptake inhibitors like Prozac. And, that was something that kind of helped move the needle in the right direction. But you still have a lot of people who are struggling with that and who, with depression and who are not responding necessarily to the types of treatments that are out there. Same with post-traumatic stress. So I think as you're seeing more of these mental health needs, and again, I don't want to harp too much on this, but looking at sort of the social situation we find ourselves in, rising, problems with climate change and political strife and, all that type of stuff can really ramp up the anxiety and the mental health problems that people are facing. And so I think it starts to beg the question, well, what else is there that we can use as a tool to try to improve that situation? And so, I think that that's another big piece of, right now of why there is, I think, a kind of an increasing openness to looking at these anew and saying, yeah, maybe they can be used not only therapeutically for mental health conditions, but even stuff like microdosing or for spiritual practice, people who are interested in self-exploration or, getting in touch with themselves or with nature in a different way. So, again, I think there's a lot of potential here, but we're just starting to scratch the surface, which is exciting.
It is. It is. And it's a process, but it's definitely, things are moving in the right direction, at least from my view and my perspective. And it's exciting and it's certainly encouraging to see where we're going with this. And again, I commend you for the work that you're doing to help, keep the ball, so to speak, moving forward here with everything with psychedelic research and the clinical trials. And again, I just want to thank you so much for taking the time to speak with me, and I look forward to connecting with you again and diving in. There's so much to talk about, hard to just sort of encapsulate everything in just one conversation, so I hope we get an opportunity to speak again and touch on some other topics.
Absolutely, yeah, definitely, let's keep in touch. And one other study that I did want to plug was we are now have launched an online study for people who are planning to use psilocybin outside of the research laboratory. So people who are out there in the real world using psilocybin, just to understand, you know, how their mindset and the environment where they take psilocybin impacts the outcomes. And, you know, if there's any sort of mental health effects that we want to be aware of, and that might help us conduct some new studies in the future. So we're doing that one in collaboration with a organization called the Unlimited Sciences. So if you look up Unlimited Sciences, you'll be able to find them, or you can go to our website, hopkinspsychedelic.org as well. But that's a new one that people can participate in from the comfort of their home, so they don't have to come to the lab. So.
Okay, very fascinating. And I'll be sure, once we get off here, I'll make sure we get those links, and then I'll have them added into the video afterwards. So if anybody wants to check that out, they'll be able to just follow those links there. So, Doctor, again, thank you so much. I really appreciate it.
All right, David, you have a good one. Thank you.
You too. Thank you.